I actually have cheekbones now. I have a chin. I have eyelids. When I put my makeup on, I'm so excited.
Hey, it's Dr. Guy, the Face Guy here. Just want to kind of go over a patient that we're about to operate on. She was kind enough to let us do some videoing and just kind of talking about the whole process and analysis and those things. So today we're going to be doing what's called a mini facelift, and I'll explain a little bit about that. We're also going to be doing upper blepharoplasty and removing a little bit of the fat pad, as well as a lower blepharoplasty and removing some skin. And then she also has a little small cyst or something here on the eyelid that we're going to remove. So when looking here, mostly here in the chin, not the chin, but the neck area, we have some excess skin that's going on. So when I'm talking between a mini facelift and a facelift, you'll see here when I mark the incisions, both the mini facelift and facelift in my definitions are both extended deep plane facelifts. As you can see here, all this kind of excess skin, even if I just kind of pull that up, I get a nice profile. And so I think a mini lift is going to be everything that she's going to need. But here in the face, when we kind of pull up, there's just still a little bit of fullness here, and that's the buccal fat pad. And with the extended deep plane facelift, I'm able to access that from the incision. I don't have to go intraoral. I know there are some surgeons who like to go intraoral. I usually just kind of take care of it while I'm there. When looking at her upper eyelids, you can see she's starting to get a little bit of excess skin. It's not too bad. It's not fully rolling onto the eyelashes and pushing the upper eyelid down. Let me have you raise your brows for me. There's a little bit of fullness you can see here, a little bit there. We're gonna take out some of those medial fat pads there. And then she has some prominence of her fat pads to the lower lids. We're gonna remove those through a transconjunctival approach, which means an incision on the inside. However, she does have some excess skin on the outside. We're gonna be removing that, doing a little skin pinch with that, just to kind of tighten that up. Move there, come across. Right there in front of you. I'm gonna have you turn your head over to the side. And come back across the mastoid, down the occipital hairline. And I know that I'm going from this right up there into that corner, and that's a good direction of the lift. You can see the buccal fat pad there. We may end up doing a little bit of lipo if there's any kind of excess fat, but all the skin underneath the neck gets behind the ear, and then in front, you're gonna get up, so something like that. But usually what we do is we're gonna start with the face, and then we'll wrap you, and then after that we'll go over to the eyes and we'll finish up there.
Okay.
So we use a tumescent solution, which is diluted lidocaine. And it's got some epinephrine in there, and the epinephrine is what's gonna minimize the bleeding during the case. And the tumescent's gonna give us long-lasting anesthesia. All right, so today is post-op day 1, meaning she just had her surgery yesterday. She underwent a mini facelift with buccal fat excision, which was those little pieces of fat on either side of the cheek, which sometimes can add a little bit of fullness here. So we all did that from the flaps. We did her upper eyelids and took out a little bit of fat. We did her lower eyelids, and we went again from the inside to take out the fat, and then we took off a little bit of excess skin, then we took out a little bit of cyst here. So day 1, you can see some swelling, a lot of bruising around the eyes, but other than that, most of the bruising is not too bad. Has a little bit of a pulled look, that's normal. Has a little bit of this weird rippling, that's all normal. That's just from the head wrap that we had on. She said she had a good night, no pain, so, and that's usually typical. Once they get the shot of Toradol, that usually helps out with the pain. I'd say on average, most people have a little bit more pain right afterwards. She did great. She's a wonderful patient, and we'll continue to show you progress. Okay, so we are 2 weeks out from the surgery where we did a mini facelift with buccal fat excision, upper eyelids and lower eyelids. Eyelids are doing great. You can see there's a little bit of swelling here. We have the typical kind of swelling that we typically will see about 2 weeks out from a facelift or a mini facelift. And that's basically where I kind of transition from the superficial plane to the deep plane. So you can see this little ridge here, some swelling up here, a little bit there. This is superficial plane, which I have to get to in order to go down to that deep plane, and that's where we're lifting. So we're gonna do some injections with a little bit of a Kinalog as well as 5-fluorouracil. That will help out with the inflammation or the swelling and also break down some scar tissue that sometimes traps that. At this point, we can start doing some lymphatic massage to try to bring that fluid back and then down. So I'll have the patient start doing some of that. We'll feel a little bit of lumps and bumps always underneath. And so what we'll do is start doing some injections of this concoction or cocktail to go ahead and speed things along. The body naturally would take care of it, but I'm just not very patient when it comes to this. Some of my patients are, but I always like just kind of speed things up. Usually patients will start to kind of notice a difference here in about a week, I say. Some of the areas that are firm will start to soften up. But typically what I do, as long as things are going as planned, I will go ahead and see my patient now in another 2 weeks at the 1-month mark. And at that time, we'll probably be doing some more injections. These will be a little bit smaller, and everybody's different. She had a lot of skin that we lifted in the face, and so when I have those situations, I typically see a little bit more of that kind of swelling, a little rippling here, versus some of the patients that might have a little bit less. But yeah, other than that, she's doing great. She's at the 2-week mark, so she is free to go back to her activities of daily living. As far as exercise, she wants to go exercise. I do tell them, if you do that, you may feel some swelling. That is normal. I still haven't had a hematoma form or anything like that after 2 weeks from somebody exercising, but if they wanted to lift what they were lifting beforehand, go back to the gym, that's all fine. So we'll see here another 2 weeks.
My name is Amanda. I'm 58 years old. I lost a bunch of weight, so I had a tremendous amount of loose skin. You couldn't even see my eyelids when I put eyeliner on. You couldn't even tell I had it on. Very puffy under eye. I would wake up every morning and wonder how puffy it would be. So I had a mini facelift, the upper eye and lower eye, and 2 buccal fats right here. And I had my procedure done in the office because 1, I'm allergic to general anesthesia. And 2, he said, we will make you comfortable enough that you don't have to go under anesthesia, which I thought was a plus. So I had it in the office. I could hear him telling me to do things like look up, look down. But throughout the whole thing, I was either asleep or not aware of what was going on. I felt nothing. I heard music playing. It was just wonderful. And another good experience about working with Dr. Guy is his staff was so good. 3 weeks before the surgery, they had all my medications called in. I had them all at home. I knew exactly what to expect on the day of the surgery. They called me every day to check on me and see if I had any troubles. It was so well organized. My post-op experience was actually very surprising. The day they put a wrap on you the day you have the surgery. And then the next morning when you come in, you have that big wrap removed. And I don't even remember having the wrap on. I mean, I don't remember it being uncomfortable. I don't remember it being tight. So literally, I guess I did have a little swelling because each week when I would come in, all of a sudden there's cheekbones. And then all of a sudden there's a jawline. And then there's a chin. So I guess I was a little swollen, but not. If you saw me at the grocery store, you wouldn't know I was swollen. The pain, none. I didn't even have to take Tylenol. Swelling, minimal. Now my eyes, because I think I had the upper and lower done at the same time, they were a little watery for about a week or 2, and that completely went away. I mean, there's so much more I could say. I mean, it's just a miracle. I just want to go on and on. I actually have cheekbones now. I have a chin. I have eyelids. When I put my makeup on, I'm so excited. It was a pleasant experience all the way around. It's the best thing I've ever done. Money well spent, for sure.
Hey, it's Dr. Guy, the Face Guy. I just want to say thank you to Amanda for letting us experience her journey and her facelift and her recovery. I'm blessed with so many wonderful patients that allow us to either use her before and afters, or in this case, the video of her journey. Just want to let you know, everybody's results vary. Everybody's experience is a little bit different. Pain may be a little more, a little less. Swelling may be a little more, a little less, or bruising for patient to patient. Her pain is maybe a little bit on the lower end. Swelling was maybe a touch on the higher end. But anyways, everybody's journey is different. Thank you for watching our videos. If you have any questions that we can answer, please come see us.